All right, good afternoon, everybody. How's everybody doing today? All right, very good. Welcome to another edition of our ongoing lecture series here at Life Extension. Happy to have you. Is everybody ready to get some good information today? All right, good. All right, so yeah, today we have an awesome presenter. Our name's Carolyn Zaumeyer. She's going to be discussing hormone imbalance, okay? So the title of the presentation is Unlock Your Hormone Secrets. We're going to go over topics such as what is the difference between bioidentical and synthetic hormones? What are the different ways of taking hormones? And how to optimize your hormone balance and start feeling your best. So we have a great presentation. Before we get started, I want to go over a couple of just housekeeping things. As far as questions go, I'm sure you're going to have a lot of questions today. Just to have a smooth presentation, we'll hold off to the end of the lecture, okay? And I'll go around with a microphone, I'll pass it to you, so that you can ask a question, everybody can hear you as well, okay? Also, we have Miss Julietta, my amazing co-worker over here. Say hi, Julietta. So Julietta is passing out the raffle tickets, all right? So we'll hold off to the end of the presentation, and we're gonna go ahead and pull 3 tickets, right? And you're gonna get some good prizes today, okay? All right, and then also you should have received the packet. So you've got your lecture notes. There's gonna be a survey attached to that. So that's very helpful for us moving forward. Just get some feedback from you. Go ahead and at the end of the presentation, turn that into the center kiosk. We'll have an attendant waiting there to receive those, okay? All right, and then lastly, before we get started, I really want to shout out the other vendors that have attended today. So we've got Omar. Omar's with True Grace and Nora. He's in the center table here. All right, we've got Galaxia. Galaxia's here with Dr. Mercola on the left side, and Marlene's. And then we've got Alexa in the back, or in the front. She's with Fine and Fit Med Spa Medical Weight Loss. All right, and then we've also got Janet Bond, who's an independent agent with Medicare and Obamacare. So if you'd like to sign up, register for that, she'll be available. And we've got Kelly with New Chapter. So Kelly's in the center kiosk. And then of course we've got Carolyn and her crew. They're gonna be in the front right here. Vendors are here to really provide information, get some feedback from you, and also some samples as well, if you'd like that, okay? So, without further ado, I'd like to introduce Carolyn Zaumeyer.
All right, let's get this party started. It's a beautiful Saturday, and you've chosen to be inside with me, so I feel totally honored. So thank you for coming. How did I get here? I was just a little farm girl in California, playing with my horse and all that stuff. And my great aunt Edna, she came into town, and she decided that I should be a nurse. And I was about 4 or 5, and she'd make me a little nurse's cap and tell me how wonderful it was to be a nurse. And she had graduated in the 1920s in Chicago at a hospital nursing program. Her and her friend hopped into a Model T Ford upon graduation, drove across the country to California to become nurses to the stars. They thought that was going to be their whole thing. Well, sure enough, she ended up taking care of Clark Gable in his home and many others, and she would tell me all these great stories. So I thought it would be so glamorous to be a nurse and how wonderful it was. And sure enough, I've had a great time with it. I started out here at Broward Community College. I started in my associate degree program for nursing. While I was there, I met a girl in the lab, in the anatomy lab, that was working for the University of Miami. And through that, I became a renal perfusionist, and I transported kidneys throughout the country to work my way through school. So I had my book bag, my kidney on a machine, and I was hopping on, back then, Pan Am and Eastern, and delivering my kidneys, studying in between. And then I transferred to Miami-Dade, and then I went to Florida International for my bachelor's, my master's, and my nurse practitioner certificate program. So then I ended up teaching at FAU and Duke University. So I've had my little brushes with greatness here in South Florida. I used to work with Suzanne Summers on several projects, And she was just delightful. If you ever had the chance to meet her, she was just as delightful a person as she was on TV. Just very open and comfortable, and just really made you feel good. Worked with Christy Kruger. We've done different shows on hormones. And I always like to honor Suzanne because she was such a pioneer in getting the word out about bioidentical hormones. She was even trying to get it covered by insurance companies, and that didn't quite fly, but we still have hope. So I've had over 30 years of history of prescribing hormones. Of course, that means I started out prescribing Premarin and Prempro, the horse urine estrogen. And everybody was feeling good with that. I was getting great reports from my patients that it was really life-changing for them. And I was also doing gynecology at the time, but I was working with a physician out west, and I was sharing his desk, and I noticed that he kept referring to menopausal women's psych referral. I kept seeing in the charts. And I'm like, I went to him with a stack of charts, and I said, listen, all these ladies can't be nuts, you know. And he said, oh, yes, they are. They're sweaty, they're screaming, they're crying, they're miserable, their relationships are a mess. They need to get their lives together. They need to go see a psychiatrist. I said, can I have those patients? And he said, well, God bless you. You take them. I'll go deliver babies. So I took all the old birds, as he referred to them, started correcting their hormones. And the phone calls were just really incredible. And so that just kind of buoyed me up that I was on the right thing. And then all of a sudden in 2002, there was this huge study that came out, or it had to be halted actually because it was so horrible. And it was done with Premarin and Provera, which is a synthetic progestin. And it came out that, oh my gosh, we have to stop the study because it was showing breast cancer, deep vein thrombosis, heart attack, Alzheimer's, this whole uptick, and we're like, holy cow, this has got to stop. So once that came out, over 80% of American women went off their hormones. So it's amazing we didn't have a civil war. I mean, women without their hormones, I see it every day. And so with that, I got to thinking that I can't leave these women hanging. We got to find a better solution. And I had heard about bioidentical hormones, but they certainly don't teach it in school. It's not in the curriculum, not for nursing school, or even medical school, even now for many schools. And so I had to start from the very beginning dissecting what does bioidentical actually mean? What is it? And once I got going with it, I ended up going to study, I identified the 4 of the best experts on hormone replacement therapy. And so I went to them and studied under them. And the first one was Dr. Neil Rousier in Salt Lake City, Dr. Sanjita Patti in Orlando, Dr. David Rosensweet in Naples, and then finally I went to Dallas, and I trained under Dr. Gary Donovitz, and he really brought it all together and really taught me how to dose and gave me the confidence that what I was doing was good, because I wanted to give the right hormone, the right dose, and the best delivery system. So there's been an interesting shift in the media lately. You may have noticed I was so excited to see, like on Good Morning America, they said, oh, hormones are now safe for menopausal women. They're now safe, okay. And what they're doing is they're still dissecting that one study on synthetic hormones. So at the end of the report, which I was all excited that, oh, it's good. Well, that's if you start before you're 60 is what they said. I have women I start in their 70s, 80s, and 90s, even men, and they feel fabulous, and there's no harm in that. So what you hear in the media, you always have to kind of, and even with our research papers that we look at, first off, identify, are they reporting on synthetic hormones or bioidentical? And most of the time it's synthetic because most studies are financed by Big Pharma. So to get the real good studies on the bioidentical hormones, you have to kind of dig around, but they are safe. So the latest is a consensus of 5 physicians that I know personally have dissected the research inside and out, and they're all saying women on hormone replacement get less breast cancer, heart attack, and stroke, even if they've had a history of breast cancer. What they're saying is that if you are on hormones and you happen to come down with breast cancer, that it's a lesser degree and it's not a fatality, that you heal up quicker for it. So the Women's Health Initiative in the beginning showed all these horrible things, but it's been disproven because the arm of the study, there are 2 parts of it. There is women with uteruses and women without. The ones with uteruses had to oppose the estrogen with the progestin, and that was the Prem-Pro. The ones that didn't have a uterus and had just the Premarin did absolutely fine. They had less cancer, less heart attack, less stroke, but that didn't hit the front page of the paper. It was just all, blanket estrogen is evil. But we know better. So the science now shows that the risks of HRT were initially overblown and that estrogen therapy is safe for many, many women. So what are hormones? Hormones are chemicals that are made by our glands throughout our body that control certain actions of your cells and your organs. You have receptor sites for these hormones all throughout your body. With the bioidentical hormone, with these receptors, they fit in like a lock and key, where the synthetic hormones, I picture them like a square peg going in a round hole. You get some symptom relief, but the rest is left to wreak havoc throughout your body. So what is bioidentical? Bio stands for biology, plant-based. Our products are made from wild yams and soy. And identical is referring to the chemical structure right there, is exactly the same in our product as what our ovaries and testes used to produce. So as time goes on, our bodies slowly stop producing these hormones and we don't feel well. So the good thing about bioidentical is it is the polar opposite of the synthetic, that it's supportive for the breast, it's supportive for the brain. I mean, women on hormones have less incidence of Alzheimer's and dementia. It feeds the brain, helps the blood flow. So the synthetic was the evil, the bioidentical is the good one. So basically, how do you feel? What brought you here today? Everybody's check-in sheet is different as to what their symptoms are, and I try to drill it down to at least the top 3 so I know what I'm trying to fix here. And everybody, what I'll usually hear is, this is life-changing. And I'm like, okay, can we drill it down? And they're like, yes. I get a nice, delicious sleep, waking up feeling more refreshed, feel more like exercising, and when you do exercise, you get a better result. Without an optimal testosterone level, you can't build muscle. You can only tone and keep what you have. You can't build anything. So workouts feel better, the results are better, the recovery is better. So, and you look better and feel better. So that's great. People with anxiety and depression, a lot of times that lessens to the point we're able to wean some people off their medications once we get them optimized. We actually use it as a treatment for PTSD, for returning war vets and first responders, because not that it fixes it, but it helps with anxiety, depression, mood swings, relationships, sleep, all the things that they're suffering from. So a lot of people also say joint pain is relieved. I have one large animal vet from South Miami that says that he drives up to when he hears his joints talking to him, that his joints start hurting. And that was really the main reason that he got the testosterone. But you may feel like a brain fog lifts, you may find like you're thinking a little bit clearer, sexual thoughts maybe more, sexual satisfaction far better. Some people say it's better than it ever was. If you suffer from migraine headaches, a lot of times it lessens with the hormone therapy. So there's a lot of different things that affects, all kinds of different parts of your body. So one of the number one reason people come to see me is fatigue. And I always thought, when I started with this, I thought it'd be the sex part, ED and all that stuff. But the number one reason people come in is that as their hormones decline, they lose that energy, especially the second half of the day. You may get up and you're fine, but the second half of the day, sitting in front of the TV, not that energy that you want to have. Mood swings without our hormones, we can be a little bit snappy, we can say things we really don't mean. That's how I know when my pellets are wearing down. I get a little snappy. Poor Alex, I kick him and his dog out, and then I realize I just need a pellet. So anxiety, depression, all this good stuff. Waking up in the middle of the night, I mean, if you don't have a good night's sleep, it's hard to have a good day, Estrogen is present in both men and women. Men need a little bit, but not a lot. And women, it has over 400 functions in the body. When I first started doing this, what I really noticed was the changes in the skin, in the collagen in the skin for women. I remember sitting at Sea-Watch restaurant with my mother like 40 years ago, and I was pointing out to her the women that had not had the benefit of aging with estrogen. And they were the ladies, the little old ladies with that thin skin that looked like you could tear it. It was so friable and thin. Well, what's going on up here is going on down there too. So they have crispy vaginas. There's no moisture. Estrogen is a moisture hormone. Helps with joint pain. Helps with dry eye. So if you have hot flashes during the day, that's from not having enough estrogen. Night sweats is from not enough testosterone. So they're totally different. It's interesting how that works. but helps with your brain function. My mother's 90, she's still crystal clear singing in the choir, and she's been on hormones forever. So a lot of different things with the estrogen. The testosterone, of course, we have a lot more in men than in women, but women still need a little bit. And this shows you how quickly it'll decline, and it can decline for different reasons. Like what we're finding is head injury, like concussion, for our football players, anybody else in car accidents or whatever, that can drive down the testosterone in a minute. And what I've also seen is a lot of women, after they've had their babies, they'll test their testosterone, and it's so low they can't measure it. So why do they not feel so well? So we get them topped off and they feel much, much better. Here are the signs of LowTE in men: feeling sluggish and tired all the time, gaining weight, especially around the middle, losing your muscle mass, not being able to build that muscle because you don't have an optimal testosterone level, depression, irritability, and lack of sexual desire. I didn't think that was possible, but it is. I hear from men. Not my eyes, but anyway. Okay, natural testosterone for both men and women. It just really can give you back, maybe turn back the clock maybe 10, 15 years to where you really felt well, get that pep in your step, get that, feeling vibrant. This one gentleman told me that. He said, I want to feel vibrant. I said, okay. I call him after 6 weeks. I feel vibrant. I'm like, okay, we get it. So just an improved sense of well-being. The way I look at it is we've got so much to live, and let's say we start here. We may have, 10, 20, 30, 50 years left. Whatever this is, we don't know what it is, but I want it to be fabulous, not just so-so. A lot of people will just say, okay, this is aging, I'm gonna age naturally, and picture an apple that you put on your counter, leave it for 3 months, and go back. That's aging naturally. That's not how I wanna age. So you see all these beautiful protective things, that having a youthful hormone level actually helps protect your heart, your brain, your bones. Testosterone actually helps rebuild bone. We're correcting osteoporosis and osteopenia utilizing testosterone. Helps you lean out. If you think about it, guys are their leanest usually in their mid-20s or late teens, early 20s, and most of them are lean and muscular, unlike their dads who have the belly fat and the man boobs with the low testosterone. So it hits a lot of good health things as well as feel good effects. So traditional medicine, how do they usually treat this? They often treat you with medications that are like Band-Aids. They're not treating the root of the problem, where if we could just treat the root of the problem, you wouldn't need all those. So right now, it's gold standard. If you go to your gynecologist, any MD gynecologist, and you say, listen, I've got hot flashes. You know what they prescribe? An antidepressant. Fabulous. You weren't depressed, but now you're on an antidepressant. Chances are you're going to gain weight, so what are we going to do? Oh, let's put you on some phentermine. Oh, good, that's good. So now you're on 2, but you're all jazzed up on the phentermine, and your blood pressure goes up. Okay, so let's give you some blood pressure medicine. Okay, so you're still fat, and you're still miserable, and so cholesterol medicine, we need a little bit of that. I mean, what's next? Now, and of course, that's going to jack your thyroid, but we like to correct thyroid, so that's another one. So we have all these where we could just age hitting the root of it and not have all those prescriptions. Most of my patients want to take less pills, not more. So what I use is a pellet system, and it's just compacted hormone in a tiny little pellet that gets inserted under your skin on your backside in the upper outer quadrant of the buttock. And when the blood supply passes by, it picks up the little micro pieces of hormone and gently raises your hormone levels up during your first 4 to 6 weeks, and then holds them steady for 3 to 5 months for women, 5 to 7 for men. Men only have to come in twice a year. So that's pretty good. The pellets, the first studies I can find are from 1939. I ran into the pellets in 1979. I was training in surgery in Memphis. We did a hysterectomy on a woman, closed her up, rolled her over, put the pellets in so that when she woke up, she wouldn't feel so bad. So they have been used in this country for many, many years, and with that, we have hundreds of studies showing not only the feel-good effects, but the safety, and also how much healthier it is to age with youthful hormone levels. So at LowTE Florida, we try to help your body return to its normal hormonal balance and physiological state. Get it working the way it used to work, to when you really felt well. We base this on the right kind of hormone, which is bioidentical, the right amounts. I can individualize your dosing. That's when I see these people that are getting their hormones through the mail, that they do a Zoom call or whatever. You're not doing yourself any favors with that, because with the individualized dosing, sometimes I alter it when I see your body type. You know, I'll have it in my head what I want to give you after all my years of experience, but then when you come in, you know, a 5-foot woman, 100 pounds can look totally different. You know, it depends on the makeup of the body, and I can do that. And I've been dosing and treating patients with this for so many years. I kind of got this. I was the first pelleter in Florida, the only one. I've been #1 in Florida for all these years. I'm in the top 10 in the nation. This is all I do. This is what I've got. Used to do gynecology, but the hormones took over my life. The other part is giving the right delivery system. The pellets are the safest way of getting hormones into your body. It's not going first pass through the liver where it can cause damage, where if you were to take an oral pill, that's what would happen. So how do I personalize your dose? Well, utilizing my experience and my education of all these million years, I take into account your age, your weight, your exercise level, your activity level, because people, if you picture the pellet like a little bar of soap with water dripping on it when your blood supply is going around, if your heart rate is up, your cardio, like teaching spinning this morning, Doug, you're going to burn through it quicker because your blood supply is passing by faster, and it's going to pick up more of the pellet, which is great. You're going to have a better workout, better results, but you may go through it a little quicker than a couch potato, but you're going to feel better and look better and have a better life. So we take all that into effect. Now the benefits of our pellet therapy is it's safe. Hundreds of studies, over 80 years experience, long-term safety records. It's used in 5 continents. It's clinically effective. What I like about it, any other delivery system, you take in a bunch of hormone, a bunch of chemical. Your body has to process it. Let's say you take a shot. Your body, your heart, your liver, your kidneys has to process that chemical. You feel like Superman for a day or two, but then it starts to wear down and you feel kind of grumpy and miserable before you're due for your next shot. The same with if you use a patch, it comes in, but it starts to wear out before you're due for your next patch. Same with the creams, you're rubbing it on. There's studies that show over 45% of people don't absorb medication through their skin at all. So you could be buying this stuff and rubbing it in, hoping for the best, and getting nothing. So the low side effects profile, I mean, what the negative of what people may notice is in the beginning, if women are coming from ground zero with no hormones, because they're in like their 60s, they may notice a little bit of breast tenderness, nipple tenderness. If you have a uterus, you may notice a little bit of cramping, but that's anything untoward usually resolves within the first 4 to 6 weeks. And I take all that into effect when I'm dosing, because a lot of practitioners will want to, boom, give you a huge dose of estrogen, or testosterone. You may not be able to take a shower because things are so tender. So you have to go to the right place to get the right amount of medication. The testosterone therapy is the best way to increase bone density. So if you've had a bone density study and it shows that you have osteopenia or osteoporosis, this is a totally natural way to reverse it. And I've seen it not just in the studies, but clinically. I have patients coming in, treat them for a couple years, redo the bone density, and it's improved. It can go from osteopenia to normal. I had a lady that was crying on the phone with me the other day because we did her bone density, and she was so happy that her numbers had improved. She had severe osteoporosis, and she thought she was going to have a horrible old age like her mother, who had severe osteoporosis. And so to see the numbers coming down, and I've been treating her for about 8 years, and she's now back into like the little osteopenia thing, give you another couple of years and she could be normal. I mean, it actually relays bone. I mean, isn't that better than those chemicals, the drugs, that potential side effects is a necrotic jaw, blood supply to your jaw. No dentist is gonna work on you. Or the other fun one is bone cancer. Okay, you got nice strong bones, but you got bone cancer. So I would rather go for a natural therapy for osteoporosis. So and there's no evidence of increased breast cancer risk. And that's being proven time and time again, and the studies just keep coming out. It's all good. It's so nice that what I'm doing is having positive results coming out. So no increase in blood clots. Remember, we thought with birth control pills and Premarin, and what it was is that devil progestin that they always, try to balance out the estrogen with it was the problem. So what we use is all bioidentical, so it doesn't have an increase in blood clots, heart attack, or stroke. So why choose LowTE Florida? Number one hormone pellet provider in Florida for the past 11 years, recognized in the top 10 throughout the nation for the past couple of years. I teach and mentor doctors and nurse practitioners throughout the country. Distinguished alumni at FIU, very well respected in the community. Many doctors are referred to me, which is interesting because when I first started doing this, I got a lot of kickback from the local doctors because they didn't understand it. And if they're not up on it, they're down on it. So now I have OBGYNs that are referring to me, primary care. I even have 2 oncologists, cancer doctors, breast cancer doctors that are referring patients to me. So what does that say? They're up on their research. If you need the names, if you want to have an enlightened oncologist, I got some good ones. So that's LowTE Florida. So what you need to know is not all hormone therapies are the same. They're not created equal. Not all hormone providers are knowledgeable and have the experience that we have. And the hormone replacement therapy is not a one-size-fits-all approach. And you need an expert, so you got me. You. So how do you start to get feeling more like your old self again? You can call our office to schedule your free consultation. If you complete the little drawing card, we have a gift basket and things that are going to be drawn for that, but you'll also be able to be on our email list where we can give you more information. So we have a couple of our gifts. Life Extension is doing their own drawing and we're doing our own, but we have a gift basket valued at $200, a lab draw for your blood valued at $250, and then also a gift certificate for $50. So if you'd like to participate in that, she has more of the cards and pens and all that if you need any. If you need one of those cards, stick your hand up. No, they were up front of the check-in desk. Yeah. So you have some time, but let's get those done. But some of the other things we provide at LowTE Florida is weight loss. There's a great medication called Contrave that helps with your cravings and your appetite. And then we also do the HCG diet. I don't know if you remember that from years ago, but it really works. We do that. Vaginal rejuvenation, if you have mild urinary incontinence, recurrent yeast infections, anything like that, we can help with that. Botox or Dysport, if you want to get rid of your mean girls or the curtain up here, we can do that. And the pricing is very good. And we also have this machine called the InBody, and it's a body composition measure. And we do this for every patient that starts on our weight loss program or on our hormones, because we want to be able to track the amount of muscle versus fat in a year to see how much better you're doing, how much your body has improved, and then also with the diet program. We have our own Victoria. She's back at the table over there. She's our chief phlebotomist, and she does a beautiful job with a tiny little butterfly, drawing labs, and also gives skinny shots and B12 shots. I also interpret the labs. I go line by line with you over the labs. I don't just have an MA call you and say, oh, your labs are normal, because we know that normal is not optimal. That reference range doesn't mean you feel good. And that's why your doctor looks at your lab and say, oh, you're perfect, you're fine. And you're like, but why don't I feel good? Why don't I have any energy? What about my mood? And then thyroid management. Through this, I've become kind of an expert on thyroid, because what happens is the symptoms of a sluggish thyroid can overlap with low hormones. And I don't want you to fix blood and still have you not feeling well. So we tested thyroid 4 different ways, and I'm able to do some dosing, and we use bioidentical thyroid, NP thyroid mostly, sometimes Armour thyroid, and we use that to help get your energy back, because the thyroid gland controls your energy, your mental clarity, your metabolism for your weight, your hair, your heart, a whole bunch of different things. And to get that up into the upper quartile of the range, that's where you really feel well. We also have B12 shots and skinny shots. I do have a new book coming out, and it'll be available online. It's Are You Hormone Curious? And it's kind of like, I wanted to put together a book with the research backing up all these good things that I'm promising, because I've been saying these things for years, but I didn't actually have something I could hand you that says, here's the studies of that bases what we do. So I think now is a fun time. Questions? Oh, Christopher? I think he was going to man the microphone. There we go. So he's going to help with the question. So if you have a question, just raise your hand. Then hustle it up. Wait.
So I know that most of your presentation was about giving hormone replacement or bioidentical hormones for people that are aging, but I'm 29 and I know most of my friends are experiencing irregular hormones. So are you seeing more and more young people coming into your practice, and what do you prescribe differently for the younger generation versus the elders?
Yes, okay, yes, we do see an influx of younger women because the premenopause and perimenopause can be taxing and they're not feeling well. So yes, we do treat that and we do adjust that. You wouldn't be getting, depending on your labs, chances are you wouldn't be getting estrogen or maybe a little bit of progesterone depending on your cycles. And then, but testosterone is a real game changer, you know, for the energy, the mood, the sex drive, anxiety, depression. And the anxiety in this country now is off the charts. Very rarely do I hear somebody during my consultation that says they're not suffering from anxiety. So, I don't know, we gotta work on that. But yes, so yes, we do treat younger ladies.
If a male was on TRT, testosterone replacement therapy, how long do you have to be on it before it raises your prostate cancer risk?
It does not. That's the fun part. The theory.
Synthetic?
The synthetic, I don't talk about the synthetic because I only deal with bioidentical, and I haven't really seen a correlation with that. The old theory was, and what we were taught back in school, was a high testosterone level could encourage prostate cancer to grow, that it could cause it, make it grow quicker. What we've learned is a youthful level of testosterone, more like when you're in your 20s. When you're that young, nobody has prostate cancer when they have their highest level of testosterone, so it just doesn't make sense. But it's been disproven and disproven. If you want to read about it, Dr. Morgentaler out of Harvard is the expert on it. He was actually treating prostate cancer with testosterone pellets.
Testosterone what?
Pellets, what we use, the pellets. The things that go into your skin that we've been talking about for now.
Usually when they treat prostate cancer, they give you a Devrone shot
Yeah.
that it shuts down your testosterone.
Yeah, it's different.
So you're going the
treatments.
opposite direction.
Yes. No, that's why you need to read Dr. Morgenteller's book.
Dr.
Morgentaler. Yeah. Very good.
Hi. This is just a question that just came up into my mind. You offer Botox, correct?
Yes.
Now, that is a chemical injection that will go into your system.
Yes.
Does that affect any of the hormones?
Not to my knowledge. I've been getting it since I was 26. And I worked with a dermatologist that brought it to America, and he needed a guinea pig. So that was my forehead. And with this good German Irish skin, I was all wrinkled up already. So, yeah.
So there's been some studies.
Oh, yeah.
And it's
And
okay.
I think it's good. I love my Botox. Never given that up.
Thank you.
Hi. What are some common indicators that you see in your practice for women in their 40s that would indicate for them to either modify their diet or start thinking about getting the pellet placement?
Right. And we didn't talk about diet. Diet is so, critical, that you've got to have the good nutrition and the good supplements, good thyroid management, the whole thing. It all kind of goes together. But for the younger women, say in their 40s, we'll hear sleep, anxiety, just don't feel well. Why don't I feel as good as I did 10 years ago? Just a change in the personality almost, So it's like, if you notice changes, call. We can always go over it. We do, your blood work is very comprehensive, and we identify things that you have no clue. In the last month, I found, I think, 5 diabetics that didn't know they were diabetic because I do an extra test that their primary care doesn't do. So there's a lot of different things that could be making you feel not as well, but we have to dive down and look at you as an individual and see what that is, and then we can correct. We can make a plan.
Thank you. One more quick question. How does the synthetic pellet compare to a biosynthetic?
They don't.
Biosimilar.
There is no synthetic pellet. All the pellets are bioidentical. The synthetic would be more of a pill or a shot, but not in the pellet.
Okay, thank you.
Thank you. So you just mentioned that you're doing a comprehensive blood test in your lab. A lot of the doctor gynecologists don't do any testing when it comes to discussing hormone replacement therapy because they mentioned that estrogen fluctuates a lot, and the best way to measure is to do time series, which is refused by most insurances. So what do you look at in your blood test, and how, what do you follow up with after you have the pellets after a few months?
Yeah. What we do is our initial panel includes the CBC, so we're checking your red blood cells, white blood cells for infection, leukemia, anemia. We do a chemistry that checks in on your kidney, heart, liver enzymes, your sugar. We do a hemoglobin A1C, which is a predictor for diabetes, and if you fall into the pre-diabetic range, we give you information on how to chase it back out of there so you don't age with diabetes. We test the thyroid 4 different ways: testosterone, estradiol, FSH for women, PSA for men. Pretty broad. It's more than, like you say, traditional medicine does. And one of the reasons they don't test you is they don't know how to manage it. Like, I don't test cholesterol because I don't believe in statins. So why would I test something that I'm not going to treat? If they don't understand the role of testosterone for women or even estradiol as you're aging, then why would they test it? And to learn about it, you have to go outside. You have to go on a quest like I did to learn it, because it's not in school, it's not in your textbooks. You have to learn it and then practice it and get the nuances of it. Because hormones are very powerful in a good way, but if they're not given properly, they can be powerful in a bad way. That's why you need to go to somebody that's all they do.
Hi. Earlier you had mentioned about, the medical field not acknowledging bioidentical hormones and prescribing synthetic. So do any insurance companies cover the bioidentical hormones?
I've heard that once in a blue moon, yes, and so what we can do is but for the most part, no. They don't want you to feel good and age healthy and all that. That would make too much sense. So what we can do is provide you with a super bill of whatever you've spent with us, and you can submit it to your insurance, and you may get a nice surprise, but we don't deal with insurance companies at all.
Okay,
Yeah.
great, thank you.
Yeah. I'll get you.
Some good questions.
Hi.
Hi. Since testosterone is a anabolic steroid, will that have any effect on a male that has a history of BPH?
The studies are actually showing that it's actually helping shrink the prostate a bit, that's very supportive to the prostate, that it's not going against it.
Yeah, because anabolics will usually result in cellular proliferation, which could cause an enlargement, potentially, of the prostate.
That would be the synthetic. I have a urologist that's referring me patients from Holy Cross.
Yeah.
And
yeah.
they have BPH, they have, they may have a high PSA, but he's managing that.
Right.
But he knows, he's up on the research, and he knows, and I can give you his name, the research on how protective the prostate, testosterone is for the prostate.
Right. Okay, thank you.
Yeah.
Hi, thank you so much for being here and doing this for all of us. I have a question about the pellets, how they're inserted. Can you go into a little bit more detail about that and what they are made of?
Yes,
besides
yes.
hormone?
Okay, if you come up here and drop your pants, I'll do a demonstration. What you do is you be laying on your side on my exam table. I take a little bit of numbing medicine, and that's the only part you feel. And it's like 3 to 5 seconds of a stick and a burn on the upper outer quadrant of the buttock. Clean it up real good, then do a tiny little incision, use an instrument, a tiny instrument to deliver the pellets a couple inches away, and then put on little steri-strip bandages, gauze, and a clear bandage, and it's waterproof so you can shower, but no swimming, soaking, or hot tubs for 3 or 4 days after.
I'm sorry, what are they made of? Is it plastic?
No, it's just compacted hormone. It totally dissolves. There's nothing added in there to have an allergic reaction to or anything, and we don't have to take anything out like the old more plants. Yeah.
Hi, more than a question, I want to commend you that I have been in bioidentical hormone for several years and really changed my life. I really recommend to the people. I have recommended some of my friends, but they say, no, I'm very scared of cancer. I say, don't be ignorant. I mean, go and make the research. This is different. Even my husband, that he's older than me, I almost 60, he's 77. And finally, I convinced him 2 or 3 years ago. Yeah, and his life changed. Now he's getting a little muscles or sexual life really improved. And I feel again alive. I really recommend that.
And I hear this so many times that it's life-changing, that it just really turns things around. Where you have the hopes of having a good old age instead of just slowly declining and declining and declining.
Yeah, my question is regarding the oncologists. When you have cancer, they deprive you from hormones, and it's really ugly.
Yes.
Because your sex drive changed
Yes.
completely.
Yes. The good part is we've got some that are enlightened, that are looking at the research and learning how good this is. And I've had a couple of patients referred over just because the oncologist understands how the quality of life could be so much better with hormones versus without. So after their treatment, they're stabilized, they're being followed up. Yes, then we do treat. Mostly if it's a breast cancer, we'll treat with just testosterone. We may throw in an aromatase inhibitor with it so it doesn't aromatize to estrogen if their oncologist is nervous about that. Yeah, so it is good. Get you feeling better again. Yeah.
Hi. Here.
There you are.
Yeah, I just want to know, what are you mentioned the 4 things for the thyroid, what are they? Can you tell me?
We do the TSH, even though I really don't pay much attention to that. And that's what traditional medicine looks at. They look just at the TSH. That's your brain telling your thyroid to produce hormone. I don't care about that. I want to know what's circulating in your body that's helping you with your energy, mental clarity, your metabolism, your hair, and all that. So I look at the free T3 and the total T4, as well as I check for TPO antibodies, and I found many people with Hashimoto's thyroiditis that didn't know they had it. So that's the 4th one.
And how old is too old to take bioidentical hormones?
I'm never going off, and I'm starting patients that are in their 70s and 80s on hormones with good results. You have to go low and slow. I'm very conservative with my first dosing. I don't want to give you a huge bunch of hormones and have you not feeling well. So we take baby steps. So there's no cutoff on the age. The only patient that I won't see is somebody with an active cancer going on. Until that's, in remission, and they get the clear from their oncologist. Other than that, yeah.
Okay, thank you.
Because we're basically giving you back what your body used to naturally produce. So how could that be bad? I mean, those hormones, your estrogen was the highest when you were pregnant. Did you have breast cancer? No,
How long is that treatment? How long?
How long?
Yeah, is that treatment?
The treatment we use lasts 3 to 5 months, and you can keep doing it forever. Yeah.
Well, thank you. The young lady back there asked my question because when that study came out, I know quite a few women in my family just abruptly stopped. And I'm thankful that nothing happened to them heart-wise or what have you. And I haven't ever heard anyone say that you can start hormone replacement therapy after age 60.
Yes.
Most doctors would say, you have to start before in order to get the benefits, etc. So originally my question was going to be how old is too old, and what would be like your absolute rule out, which is what you answered. So that is
yeah. But the thing about the hormones is you can bring them back and feel good, and there's no harm in it. There's no harm in having a youthful hormone level. I would kind of like.
So do you have any information if there's been any mild cognitive decline, if you've seen any differences for those that may have started later in life?
I've had some patients that actually were already diagnosed with Alzheimer's that are doing much, much better. And so it is helping, the estrogen helps with the circulation of the blood flow in the brain, helps, with cognition, both testosterone and estradiol. But no, I haven't had that. And the interesting thing is that I pelleted over 20,000 butts, so claim to fame. With that, I've had a handful of breast cancers come down. And breast cancer is interesting. It takes 7 to 10 years from the time the cells decide to go bad before you can actually fight it. So if it's coming down the pike, it's coming down the pike. The good thing about what we do is we insist on annual mammograms. And I know there's probably a lot of thermography fans out there, but annual mammograms are the key because, early detection saves lives. And it's not that what we do promotes it or makes it grow. It's just that we want to know you're healthy while we're treating you. And that's really the only reason. Yeah.
Thank you.
Oh, you're the best.
Yes, I wanted to just give Carolyn a testimonial. I have been her client and patient for over a decade. She's wonderful, fantastic, and I also have thyroid issues. And you shouldn't hesitate to get on this program, but I will tell you this. Be prepared to battle with your physician because they just don't understand. And so if you're on heart medication, oh no, you can't take testosterone. If you have thyroid, there's also feedback you'll get from your doctor because they don't like to see the TSH and the T3 out of sync. And it may happen. So my testimonial is over a decade, and don't hesitate. You should get under the care of Carolyn.
Oh, thank you, Dr. Scotty. The interesting thing about the kickback from the medical community is they just don't know. They don't understand. And the thyroid that we use, the NP or the Armor, drives down the TSH. And traditional medicine was taught that if the TSH goes low, it can promote osteoporosis and diabetes. It doesn't. It's been totally disproven. So many of the things that they're basing their comments on is just old studies. They're not up on the new stuff. And if you'd like to have any of your doctors call me, I'd be happy to chat with them. Yes. Yes, osteoporosis, both estrogen, as we're aging, estrogen helps support the bone, but the testosterone actually helps rebuild bone. And we've had, time and time again, we see the studies getting better and better, which is fabulous. Yeah. Any other questions?
Quick question back here in the back.
I hear you.
I just wondered if there is an adverse event or reaction to the pellet, how can you remove it? And then also, how does your body readjust to making hormones?
Yeah, well, usually by the time we treat you, your body's done making hormones. And it's not like it's going to start making hormones again on its own. It's just not going to happen. With the pellet, there's nothing to have a reaction to. There's nothing to be allergic to. There's nothing for a reason to remove it. I don't have people saying, get that thing out of me. The only people that do, I shouldn't have pelleted from the beginning because they were a little bit wrapped up that it was going to hurt them. So it's almost like doing a psych evaluation during my consultation, because if you're not totally on board, I'm not going to pellet you. If you're going to be so twisted up over breast cancer, which is ridiculous because the studies aren't there, then I'm not going to pellet you, because that's going to make you nuts and I want to make you good, Yes.
So is the pellet compounded for you individually?
The pellets, we sound like it's made for you individually, but it's not. I do so many. I have an agreement with the FDA and the compounding pharmacies where they send me cases of these pellets, and I go through them quickly. And I have 5 different doses of estradiol, 5 different doses of testosterone, and then I compare them up. Like my initial starting dose for estrogen will be 6 milligrams, but it may be 125 of the testosterone. So I'll take 100 and the 25 of the testosterone and the 6. They all go in through the same little slide, and it's all good. Yes. Oh, Cleveland Clinic doesn't like what I do. They don't like hormones as a rule. Right, I've seen those, yeah.
Your level keeps dropping because then you hematology, oncology, blood cancer. So I did a little research and I found out that I'm taking the leave every day for because there was a positive
Right.
Oh, now you're not.
Yeah.
You need to watch for that
Yes.
in your lab.
One more question?
Okay, we're going to take one more question for the sake of time. If you have any more concerns or questions, feel free to come to the table, okay? And they can meet with you one-on-one. But we'll get one more question in.
Actually, this is a comment. I'm 70 plus, and before I met Carolyn, I was a total bitch. I had no friends, family hated me, and then now Carolyn has gotten me back on track. So, I don't think age has anything to do with it.
Thank you. Thank you. I didn't plant these people, I promise you. It sounds like I could have, but I didn't.
You know, I'll vouch for you. You're one of the sweetest customers we have. So.
All right, we're going to do a little drawing. Can we do ours first and then you guys come up?
Yes, ma'am.
Is that good?
Yeah, so let me first, how did everybody like the presentation today? I feel like it was great. Yeah, give her a round of applause. And so there's a couple of raffles going on. First, we're going to have Carolyn's group. They have a nice prize for you. So I believe we run out of raffle tickets for them. But if you haven't had a chance to fill one out, we'll go around with a card for you. So just raise your hand.
All right, so the first one we're going to draw for is that beautiful gift basket. And as my health expert, Doug is here, I saw in the gift basket are goldfish, and he would not be caught dead eating goldfish. So whoever wins it, if you don't eat the goldfish, give them to me. So this is for the gift basket. Here we go. Oops. Marcella Stock. Hey, perfect. You get the gift basket. Yeah, good job. Okay, the next one is a lab draw where we get to draw your blood and test all those wonderful things that we just spoke about. And that has a value of $250. And where should I go from? Jonathan Faye. There you go. Get a free blood draw. And then the last one is a $50 gift card. We have products in our office, skincare products, as well as supplements, and it can go towards your lab draw or your pellet, whatever you want to do. So we're going to pick another one here. There you go. Mary Ellen Kahn. There you go. Beautiful. So you get the $50 gift card. So I hope to see you at the office. And I'm gonna head back to the table. So once they're done with their drawing, if you have any personal questions you want to ask me, you don't want to call her out, I'll be there. And then this is so funny. This is the October edition of Life Extension. Is all about hormone balance. And in my book, I actually have quotes from Life Extension publications. It's so good.
Okay, Carolyn, would you mind doing us the honors of picking the 5 lucky winners?
Yes, it'd be my pleasure. Okay, let's see if I can find a good one now. Oh, this one has jelly on it. Oh, it's just a number. Oh, and I'm supposed to read that?
So we've got 0118347.
Good to have you up here.
Oh no.
I'm going to keep you with me.
Let's go 4 more. So we've got 0118369. That's 369. Going once, going twice. All right. 0118352.
There you go.
That's 0118354.
Good job. Good luck. You better go buy lotto tickets.
Keep your hand raised so Julietta can see you.
Okay, one more. Yeah. Shake them up.
All right, last one, 0118355.
Hey.
Okay, everybody. So,
thank you.
Yeah, thank you so much, Miss Carolyn. All right, everyone, you're all set. Don't forget to turn in the survey. Okay, so I'll turn that into the front kiosk. And thanks again. Have a good day.
they never win anything.
Turn this off real quick. Hopefully it's still on.
I have one more.